I love talking to my colleagues. It's one of my favorite things to do is teach other veterinarians valuable information that can really help their practice and their patients. So we'll get started. So we're going to talk a little bit about microbiome. What is it? It's a pretty hot topic now in human and animal medicine. What is it? Where is it? And what's its importance? Well, what is microbiome? It's a collection of trillions of beneficial microbes, bacteria, funguses, viruses, but really cool is it's their genes which actually live naturally in the body. So where is it? It's everywhere, actually. People think it's just in the gut, but that's not true. It's everywhere. It's on our skin, in our mouth, in our ears, other mucosal surfaces. Did you know that your pancreas has its own microbiome and your heart? Every organ has its own microbiome. It's very special. So people assume that it's just in the gut, but it's actually everywhere. It's really important that people know that, but we're going to focus on the gut today. That's really important. Why is it important? It's a, it supports your digestion, of course. It strengthens and regulates your immune system. It maintains overall health and it prevents disease, but it also helps with overreactions like allergies and chronic inflammation. It's our first line of defense against any pathogens that may get into our system, and it can outcompete bacteria that's harmful. So the importance, again, really, really important. I love this little guy. There's an army of microbes in our system. And it's important because our microbiome actually protects us against all these germs. It breaks down food, releases energy, and produces vitamins. So where does it start? It starts in the stomach, really. Well, in your mouth, I guess you could say, but we're going to go down a little further because we're going to be talking about fecal transplants, microbiome transplants today. So in the stomach, of course, basic physiology, in the stomach, the acid will kill harmful bacteria and funguses, and it supports protein digestion. That's if you have a healthy stomach or gut. If you have an unhealthy gut, your acidity is low, your vitamin and mineral absorption is delayed or deficient, and that can lead to an enzyme deficiency or candida overgrowth in people or yeast infections in dogs, cats. Bacteria and fungus flourish in low acidic environments, and you can get really sick from that. Obviously, your microbiome is off. Then we go down to the intestine. The intestine has an alkaline pH. It activates digestive enzymes. It breaks down food. It prevents clogging of the microvilli, which when the microvilli is clogged, it's obviously not going to function. That can lead to a risk of leaky gut syndrome. And then the intestine also enhances the immune system strength through a healthy microbiome. So it's a pretty high number. 70 to 80% of the immune system resides in the gut. That's huge. It's everything, right? That's a huge part of us. So it's really important that we keep our gut healthy. And how do we do that? Well, here's some different things that help our gut, right? Or what our gut does. It's vital for digestion. It's really important, obviously. It breaks down all our complex carbohydrates, our fibers, our proteins. It's essential for life, right? Nutrients, energy. It helps our immune system. It acts as our first defense. It regulates and prevents the allergies and inflammation. It has a role in obesity, if you could believe that. That's huge, right? Which we have a huge problem in this country with. Even in animals, we have an obesity issue. But we can manage some of that by keeping a healthy microbiome. And then connection to mental health. The gut-brain axis is huge. It can really focus on our ability to think, our ability to act, even mental health. And then one thing I really want to point out is everybody's an individual. I think we tend to group things together. Every animal's microbiome is different. And I'm going to present a case today, and you'll see that at the end, on how unique our patients are and how interesting and different all of our microbiomes are based on where we live and how we live and what we eat. So I'm going to talk a little bit about ozone. That's my most favorite subject. And I was going to ask, I'm going to take a little poll for those of you who are joining us. How many of you are actually using ozone in your practice? Some form of ozone. We're going to take a second and see how many are using ozone. See some numbers going up. It's exciting. It's getting more and more popular. If I had my way, I would lecture every day to every college about ozone therapy. So it looks like, if I'm right, about 50-50, somewhere about that. 50, we have 47% to 53%. I want to change that 53%. We need to get ozone and microbiome into your practice. It is a huge game changer. It's absolutely amazing. So ozone, simple, right? It's a little tiny molecule. It's got 3 little circular balls or oxygen molecules on it. I'm going to take this off my screen because I can't see my slides. Sorry. There we go. It's 100% natural. So who doesn't want to use something that's not 100% natural? It's basically 3 molecules with a double bond. The double bond is an oxygen molecule. And then you have a single bond between 2 oxygens or 2 oxalates. And it's a very unstable molecule. So when it hits the surface or air or in the body, it'll break that singular bond. That becomes a free radical. And that free radical is actually very attracted to anything that's inflammatory, bacterial, fungal, and it attaches to the cellular wall of those dangerous molecules or dangerous inflammation cells, bacteria, and it basically tears them apart. It destroys them. And then you're left with an O2, which is oxygen. So it's almost like hyperbaric medicine. Oxygen is very healing. So it's a win-win, basically. And it's a very easy way to treat disease. Let's see why I'm not going here. There we go. So it's a highly reactive molecule. It's very powerful. It's a powerful oxidizing agent, and it's capable really of interacting with organic and inorganic substances. And it's really well recognized for its anti-inflammatory, antimicrobial, immunomodulatory, and tissue regenerating effects. It can really attack things such as bacteria, mold, right? We don't have a whole lot of things that attack mold, viruses, fungus, mycoplasma, which is also another really difficult organism to attack, inflammatory responses, cancer, parasites, and pain management. Here's some ozone equipment. And I want to share with you that we make a really wonderful machine called the Stallion or the Woofer. It's very easy. I think Kyle mentioned that I started an ozone company several years ago, and I wanted to make it very simple for veterinarians. Our motto is so simple, a monkey could do it. And VDI has been kind enough to start carrying our ozone equipment. It's available through VDI. And we've made a special, what we call microbiota package for them. And this will help you get started with fecal transplants because that's probably the easiest way to get started. But the key points when you're purchasing ozone equipment or looking for it is you want to get the proper training. It's important that you get proper hands-on training, know your proper equipment, purchase high quality equipment. Our equipment is only made for the veterinary industry. It's all been recalibrated. We are the only company that's made specific veterinary equipment. The other veterinary equipment out on the market has been originally made for the human market and relabeled for the animal market. This is specific for animals. There's a couple more things for ozone equipment that they also carry. These are the rectal catheters up in the left-hand corner, which are essential for doing rectal ozone, obviously. That's the first step in doing a fecal transplant or microbiome restorative therapy. You can see the stethoscope, limb bags, the bubblers. We have masks and wound cups, syringes. So VDI is your place to go to carry. They carry all this equipment. So what about some methods or some administration? Look at all the different ways that you can give ozone to your patient. We're going to talk mostly today about rectal ozone. That's why it's highlighted. But if you look, there's literally over 40 applications that you can utilize in your practice or on your patients. The most accepted, easiest to start with is the rectal ozone insufflation. And we use that primarily for our MBRTs or our fecal transplants to clean the biofilm, which you'll hear us talking about that. But look at all these great ways. You can do it intravenously, subcutaneously. You can use it in acupuncture. You can use it for ear and eye treatments, limb bagging, for example, treating wounds, dentals. It's endless, basically. And it's really just a way of sanitizing and cleaning wounds, cleaning bacteria, funguses, and so on. So what's the role of ozone therapy with microbiome? Well, together it's a marriage, it's a synergy, and together it will modulate oxidative stress. It will eliminate pathogens like we talked about, bacteria, viruses, and funguses, without disturbing the beneficial flora. And a lot of people ask me, how is that even possible? They can't wrap their head around that. That's probably one of my number one questions that I get is, how does the ozone know not to harm the good bacteria and only harm the bad bacteria? Well, ozone actually targets bad bacteria. It has a strong antioxidant defense, and it has an affinity for cellular walls of bad bacteria, not good bacteria. And so it has certain it goes the enzymes actually have a certain affinity to attack the bacterial walls that are I guess more inflammatory, if you will, and it can break it down rather quickly, and it's very effective in infected acidic environments. It's also combined, it'll help with the immune system modulation, which is fantastic for keeping the immune system healthy. And it has a synergy, it preconditions the body, and it may enhance the integration and colonization of the fecal transplant. So it's really a nice synergistic effect. So what is MBRT? I get a lot of people that say, what's the difference between fecal transplants and MBRT? A fecal transplant is just that. It's a fecal transplant. It's putting stool from a donor into a patient, and that's it. But we've taken it a step further. That's not necessarily the best way to do it. MBRT is a full package. It's capsules that are been MBDI carries a particular capsule that's been triple capsuled. It's a dehydrated feces. It goes in orally for your patient. So you're getting the upper part of the GI tract. Then you use rectal ozone to clean the biofilm of the colon. Then you do a fecal transplant. You also follow up with diet. You want to restore their balance and their immune function by giving certain supplementation, which we'll talk about in future slides. And this is just excellent medicine. I like to throw a cartoon in here. I think we're a serious world. We need to laugh a little bit. But really, how do you unleash your full potential? Add MBRT to your practice. It's pretty cool. You'll be amazed at the results and how simple it is. Can you tell I'm a little bit passionate about it? It's because what veterinarian doesn't want to feel good about what they're doing on a holistic level without intoxicating your animal, giving them poisons, giving them extra drugs that they may not need? So what are the benefits? It's a rapid improvement in gut health. And I'm telling you rapid, it's mind-boggling to see the success of this. It's very safe and it's non-invasive. You do not need to use anesthesia, although some of the bigger hospitals insist on using endoscopy. You don't need to do that. All of my patients are awake when we do it. It's a very gentle procedure. It's oxidative preconditioning. You're giving the pet oxygen. Mostly it cleans the biofilm. And what does that mean? It's a thick film that's created around the GI tract that's preventing absorption of good nutrients. Ozone breaks that down, and it can actually shift the dysbiosis toward balance. It's an immune modulator. It's antimicrobial and anti-inflammatory, which we discussed. It improves the oxygen, and it reduces the reliance on antibiotics. And that's huge, because antibiotics are really not what we want to be handing out left and right to patients anymore. We've learned that that can really upset the microbiome. Antibiotics were the traditional treatment, and a lot of veterinarians still use them, but we have to change our way of thinking. Antibiotics shouldn't be the first thing we grab for when we're treating a patient with diarrhea anymore. It really is important to know that it can cause antimicrobial resistance. And this fun fact here, which is a depressing fact, but it's something that we need to know, is it's the leading global public health threat, that 1.27 million deaths contribute to 4.95 or almost 5 million deaths worldwide on antibiotic resistance. That's absurd. That's unacceptable. We need to find other ways to treat our patients without hammering with antibiotics and destroying their microbiome. So the AVMA has come up with this program, and you can look on their website. There's a link down on the bottom, and it's important because we need to be good antibiotic stewards. We need to practice good medicine and not rely on antibiotics to treat everything. You only want to use them when it's necessary. But now there's some fabulous diagnostic testing, which I'm going to talk about, that VDI offers, that can help you make a decision whether or not to use an antibiotic or which one to use so that you're not just pulling something off the shelf and destroying all the microbiome. And that's our responsibility as good veterinarians. We want to be good antibiotic stewards. It's imperative. The AVMA says that we need to be good antibiotic stewards, but they don't give us any kind of option. They don't tell us what we can do in place of it. So most of us just grab for that because we really don't know any other way. And that's where ozone and fecal transplant and MBRT comes in. That's our choice. That's one of the best ways to treat a patient who has an infection simply without antibiotics. So some of the conditions that I've used and that you can use to treat using a fecal transplant is antibiotic-associated diarrhea. I mean, I'm sure most of you have used antibiotics and they cause diarrhea in pets. And so you can actually use a fecal transplant to correct that. Clostridium or bacterial infections, wonderful for that. Chronic diarrhea or small intestinal bowel disease, inflammatory bowel disease, colitis, GI imbalances, certain autoimmune conditions, behavioral conditions. One of my favorites is if I have an animal coming in from oncology that's having diarrhea from chemotherapy, fabulous way to treat. And then I always like to throw this little fun fact in that your gut-brain axis is the microbiome gut-brain axis is affected by your mood and your behavior. So you ever meet those kids that, you feed them a candy bar and they're jumping all over the place? Well, it affects their behavior. And it's the same with your pets. What you feed is important as well. That's your gut-brain axis. How you act, or if you're aggressive, can also contribute to your overall behavior and your digestion. So what about microbiome testing? This is my favorite part because this has made it so much easier. This test here is a GI test. It's the next generation DNA testing sequence. It's very simple to use. I'm going to go into this a little bit because it's really made my life a lot easier. I use this now in place of my culture and sensitivities because I'll show you comparative in the future slides. It's very simple to use. You just need a fresh fecal slide. There's no fasting required, which is great. Most of our clients don't want to do that. You can use it on dogs and cats, and it actually detects bacteria and funguses. I don't know any culture and sensitivity that detects fungal and bacteria in the same test. And so it's also available for dermatological use on skin swabs, which I will say if you're going to submit a skin swab, you only want to use it on one area. And also my favorite now, I've been using it for urine testing. It's great for urinary tract infections. I actually have had some chronic UTIs that are non-responsive to antibiotics from other veterinarians. We've done ozone, and I have found that I just recently got one of these tests back and it was mold in the dog's bladder. So nothing was going to work. There was no antibiotic that was going to take care of that. So this test is fabulous. So what's included in this test? It gives you a complete bacterial and fungal quantification. And if you look up here in the right corner, that little pretty rainbow wheel there, that's a healthy animal. That'll show up on the test. That's a clinically healthy animal. He has a nice, diverse microbiota. And then, but if you look at the other one on the right, the blue one, that's loss of diversity. It's just all blue. There's no bacteria, there's no funguses really in that wheel, or at least it's not a healthy microbiome. And when you send in this test, you'll actually get wheels with colors and different percentages telling you how the animal's microbiome, what the percentage of bacteria and funguses are, which is really important. So it'll tell you what the clinically relevant species are. It'll give you interpretations and bacterial diversity scores. It'll work with their other testing. So for example, if you're going to test for vitamin D or B12, it'll integrate those tests into this. It'll give you some recommendations. This is my favorite part. It actually gives you recommendations, goals and actions, and some treatments for what to do with that particular animal that you've sent in. I don't know if you remember in the beginning, I said every animal's different. This test actually works on the individual, which is great. And then it will also give some product recommendations. And the other thing that I really like is it'll talk about antibiotic resistance for that particular animal and what antibiotics to select if you need to, or which ones are irrelevant or won't even work on the animal based on their DNA. So that's a really amazing feature. So let's go back here for a moment. So this is next generation sequencing. And this just gives you a quick chart, a comparative of the different testing that's out there, the GI microbiome panel, the culture testing, and the PCR testing. And if you look down the columns, you can see yeses going all the way down the GI microbiome panel. It's really an amazing test. I can't say enough good about it. It definitely will help with diagnostics, um, and it gives you so much information. It also gives you a lot more species, and I think it's over 46 different species it can test for. So here's a normal. This is part of the test. You would get this on your dashboard, they call it. I think the test that you receive back is somewhere anywhere between, I want to say, like 5 to 7 pages. It's pretty amazing the information you get off of one poop sample. But this would be a normal patient. If you look over to the left, you can see the ratio there, normal cell count, bacteria to fungus. And we want to know that. It's important that people understand that it's not just bacteria in the gut. There are fungal species as well, but we also want to monitor if there's overgrowth. So it will tell us and detect if there's overgrowth of bacteria or commensal organisms, or even normal ones. Sometimes people overuse probiotics, and you can actually cause an overgrowth or a disturbance if you overuse probiotics. So that's something to think about. We don't just want to put animals on probiotics indefinitely if they don't need it. This is another way to test for that. The richness is great. It's a richness score to see how rich their microbiome is, or evenness. We want to make sure they have an even score in their gut. And then fermenters, that's really important for small chain fatty acids. We want to make sure, because that can create bloating or gas or abdominal pain. This test will actually tell us a ratio or a percentage of that and how to correct it. I don't know any other test that does that. That's pretty cool. So I'm going to present my case because I think once you see this case, it's gonna really make you think twice about how you diagnose and treat. This is Oliver. For those of you who know me very well, I'm a boxer freak. I love boxer dogs, but I love all dogs and all cats. But um, I see a lot of boxers in my clinic because people know that I really love them. And if you know, boxers have a lot of GI issues, a lot of cardiac problems. But this is Oliver. He is a 10-year-old neuter male brindle boxer dog. And I'm going to stress a point here, because if you look at my little history, it's really, really important to take a very thorough history. I can't say that enough. And I mean, if you need to dig into people's personal lives to find out information to help you treat your pet, then do so. If you look at this history, it's going to tie into the case. He was born on a small farm and he was raised in the suburbs, which is polar opposite of where he was born. He plays with other dogs at the doggy daycare, and he's the only pet in the household. And he's eating a home cooked diet. I've been seeing Oliver for 7 years. So that's a long time. And if you look at all these wonderful symptoms, we've been treating Oliver for 7 painful years, trying to get him under control. He had gulping, gagging, nausea. He was Giardia positive at one point. He has quite a bit of anxiety. Remember, I talked about the gut-brain axis. Arthritis a little bit now as he's aging, colitis on and off. He could be lethargic, gastroenteritis, vomiting periodically, regurgitating. He had chronic ear infections, gastritis, anorexia. I want to go back to that top word that says gagging. I want everybody to see what Oliver did. And just as a side note, if a client is telling you your pet is vomiting, gagging, regurgitating, coughing, ask them to send you a video. It's really important because there are so many different ways to decipher that. A dog that coughs from a cardiac cough is totally different from a dog that has kennel cough. So it might help you understand some of the symptoms and how to diagnose when you see video. So here's Oliver. I want to show you this video. This is the main complaint. And let me tell you, when clients tell you that they're staying up at night because their animal is gagging, or it's like that flea thing when they're itching at night, they hate you, right? They want you to fix the problem. Okay, I want you to see this. It's kind of sad in a way, but I didn't understand what she was saying when she said the dog was gagging. This is way more than gagging. It almost looks like he's having a seizure, but he's really not. He's actually bringing up, regurgitating food, re-chewing it and swallowing it. And he does this for 5 to 10 minutes at a time. That's horrible. This poor dog has been suffering. And until I saw this video, it didn't really have true impact. It goes on and on. So I don't need to make you sad watching Oliver, but I did want to show you at least what he's doing. And you can see he's still sitting here. I mean, and it goes on and on and on. So these symptoms started in 2016. That's how long ago they started. There he is. Look at him. He's got barium on his face. I had to take a picture of him. So cute. So through the years, we've done all kinds of testing on Oliver. We've done blood work, CBC, chemistries. We've done 40X heartworms, Ehrlichia anaplasma, Lyme disease. We've done lots of fecals on Oliver. We've done lots of spec CPLs on Oliver. Radiographs, barium studies, as you can see, the proof is right there. Thyroid panels, cortisol resting, ACTH stimulation, ultrasounds. Thank goodness these people have insurance, by the way. Urinalysis with cultures, Glacier Peak. For those of you who don't know what Glacier Peak is, it's a biofeedback test. It's a cheek swab and a hair sample, and it checks actually not for allergies, but for intolerances to food and environment. We did a key screen parasite. And again, if those of you don't know what that is, it's a fairly new test. It's far better than just your regular fecal flotation. It's an actual DNA testing of different parasites, a wonderful test. And it's also through stool. And then we did a fecal pathogen profile and a culture and a TLI. And what we got back on the blood work every single time, and he's been coming to me twice a year, he gets blood work, and every time the dog's amylase and lipase are always elevated. And every time I talk to an internal medicine specialist, all I get is, oh yeah, it's a boxer. He has pancreatitis. That's literally what I get from internal medicine. I was ready to pull my hair out because that's not really an acceptable answer. Oh, you could put him on Zofran, or you could give him a sucralfate, or they're just covering up the problem. Nobody gave me a solution until I found this test. And the ones that are marked in red are the ones that help me the most out of all these tests: the microbiome panel, the allergy panel, the advanced GI panel, vitamin D, B12, magnesium, and folate, all through VDI, if you could believe it. And look here, this is Oliver's test. This is what the tests look like. They're fairly easy to read. You fill out a history form, and at the top, if you see, they'll ask some questions like, he's on a raw food diet originally. When we first sent this in, he had diarrhea, bloody stool, he had abdominal pain. Some of those symptoms aren't on there, other signs. But we submitted an additional page with this. And this is what we got. These are some of his actual results. If you look closely, you can see that he had Clostridium perfringens. Well, that's no good. That's a bad bacteria, right? That didn't culture out in any of the other tests, by the way. It's very interesting. And then he had several other Clostridium species and other gastrointestinal bacterial species that could be rather damaging. But if you look way down at the end there, and I can never say this word, Randy's always good at it, cyclomyces. I'm going to talk a little bit about that. But before I jump into that, if you see the total cell count he had was elevated. The bacteria to fungal ratio was off. He had low bacteria to high fungus. That's not normal. And what's nice about this is it's right here on the paper. It'll tell you his richness score, his bacterial richness score. The evenness was off. He had a lot of fermentation going on in there. It was too high. And so what do we do about that? Also, I mentioned the integrating of the tests prior. They integrated the B12 folate and the vitamin D. He was low in B12, he was low in folate, and he was low in vitamin D. And for those of you who don't test for vitamin D, if it's one single test you're going to add from VDI, I would say that's probably my most favorite. Every single animal that walks through your door should be checked for vitamin D. Guarantee 80% of them are deficient. I've seen it with my own eyes. It's such an easy test. Low vitamin D can cause so many problems. Any arthritic dog that walks in your practice, any poor skin, any kind of autoimmune disease, cancer especially, check them for vitamin D. It's very important. So these are the results over here. You can see we blew them up. He was low in vitamin B12, folate. He had chronic enteropathy based off that vitamin D test. The magnesium was a little bit high. I wasn't too worried about that. It shows the TK1. He has pancreatitis. I think we confirmed that on the Antec testing for his elevated lipase and amylase. And then he also was a little bit low on protein, the CPL, low on cortisol. So, of course, this poor dog has been struggling for forever. And now we're finally starting to get some answers. So this is the test and treat. It's my favorite part of the test because it kind of makes me a little lazy. I don't have to think too much. It's telling me what to do. That's super cool, right? No other lab does that. So when we got his test results back, we saw the bacteria and the funguses. And up at the top, it'll tell us the primary goals and the possible options. So the primary goal, of course, is we want to improve the diversity of his gut flora. That's the bacterial richness that we looked at. We want to reduce the opportunistic reduction of the bacteria and fungus ratio. We want to help eliminate the pathogens that are in there, and we want to improve his clinical signs. Who doesn't want to do that? I'm sure his owner would be very happy to get rid of that gulping at 3 o'clock in the morning when she had to get up and give gabapentin just to slow him down a little bit. That was his treatment, by the way, for a long time. That's all they could get him to take. He's also quite a picky guy. So what did we do? Over here, possible options: FMT, a fecal transplant, rectal ozone, antibiotics. Doesn't mean we can't use them, but we need to respect them, and a dietary change. Well, that's exactly what we did. And we had some pretty darn great success with that. We used the Healthy Gut Restore capsules, 2 a day. We used a reduction in his yeast in his food. We changed his diet from raw to a semi-cooked, and we added a little bit of sauerkraut, if you could believe that. We did put him on antibiotics. We're going to talk about that. But of course, my favorite, voila, he came in for rectal ozone. He got ozone therapy. So look at this. This is the one that I left out because it's my most favorite part of the whole test, believe it or not. He had this overgrowth of fungus. If you look at the up in the corner there, there's a little boxer eating rabbit poop. He actually had an overgrowth of fungus, and it was this yeast. Where did he get that? Remember that history that I mentioned in the very beginning? He lived on a farm and he was a puppy, and then he moved to suburbia. Oliver has been living with this in his intestine for over 7 years. He had a rabbit mold, or yeast rather, living in his gut. And it wasn't until I did this test that I found that out. If you can see down below, it's highlighted in blue. You can actually click on that. It will take you to a Google search and tell you all about it on that test too, because they'll send it back. They'll send the results to your email, and you can click on any of these bacteria. You can find out about them. So look here. In dogs, it's been linked to chronic diarrhea and other gastrointestinal signs. I don't know any other test on the market that would have told me that. No culture, bacterial culture, no fungal culture would have told me that. Look what it's linked to. It's linked to GI symptoms. And it's harmless in rabbits. They can live with it, no problem. But it certainly can affect dogs that eat rabbit poop. So, of course, then I talked to the owner. Does your dog eat rabbit poop? She's looking at me like I have 3 heads. Why would you ask me that question? Well, because your dog has something in its stool that's showing it ate rabbit poop. She says, well, when he was a puppy, he lived on a farm. I do believe he ate rabbit poop. Well, guess what? This stuff took over in his gut. That's crazy. May cause diarrhea and GI upset. Some dogs, they say, will respond to antifungal treatment. We didn't use nystatin because that wasn't my treatment of choice. We used what we found on the results. And it's often not a primary pathogen. Most animals can clear it, but unfortunately, Oliver had an overgrowth. It was really affecting him. So here's some of the test results. If you look here to the left is a whole column of antibiotics that can be used and tested. The key down below shows exactly what antibiotics are recommended, not recommended, have poor or fair performance, good performance, or no resistance detected. So I pulled up the trimethylprin sulfa. I also try to look for least expensive, least amount of days used, all those factors for people, for clients, for animals. We want to be careful about what we use, how long we use it. This one seemed to have the best results across the column. It was NRD all the way across with a G for good. And it's a pretty inexpensive antibiotic. We only needed to keep them on it for about 14 days, but I did use that. There's where the integrative approach comes in. I like to say I'm holistic, but at this point, maybe the antibiotic isn't a bad idea. And this is, again, another good example of antibiotic stewardship. You're using these tests to make sure you're using something that's going to be appropriate. Because if you look up there on that wheel, there's Oliver's wheel, the little ratios I was talking about. You can see the diversity. And then you can see up there at the top all the different pathogens, Clostridiums, and all the different ratios that were in his gut. That's pretty important. It's good information. So what did we do to treat Oliver? Well, look here. Everything in red is what worked, and everything in black is what not worked. It's pretty simple. And this is going over several, I treated Oliver for several years. So we performed a fecal transplant on Oliver, and we did medical ozone before the transplant, and we gave him the oral capsules. So there's the ozone machine with the fecal transplant catheters. You can get those at VDI. I did use a frozen slurry from Dr. Roman. Her slurries are excellent. They're frozen. I used the RX vitamins D3 and B12 to treat those two deficiencies. The test kit, the VDI test kit is down below. That's what we used. And how did I know to use the TMS? I used it off of that, the results off of that kit. And of course, we use the MBRT capsules. Those are fabulous. Those are triple capsuled with dehydrated feces from pre-screened donors, which I'll get into a little bit about the donors. Those were his treatments. Oliver is a really hard animal to treat. He didn't do well with any of those other treatments. Look at all that stuff. It's crazy how many things we tried on him. This is just a picture. Thank you, Dr. Roman. She had somebody draw this up. This is showing when you do a fecal transplant to make sure you get the catheter into the transverse colon and seat the material deep into the colon. Of course, you want to clean the biofilm first with ozone therapy, but this is a good example of how to do this. We find that if you get it in just a small distance, it's not really going to be helpful. And we want to always use the capsules because we want to get in the anterior part of the GI tract and the posterior. So we're covering the whole GI tract. So look here, this is how we did it. We screened the donors, okay, first. The donors are excellent donors. They have never had antibiotics. They have very minimal to few vaccines. They eat an all either raw or organic diet. They have been vaginally birthed. They're not even allowed to play with toys like tennis balls because they've been made in China. These dogs are really well cared for. Usually Dr. Roman is one of the main people that the stool is involved in these capsules. Her animals have been screened for 30 years. She has excellent donors. So what we do is we actually do a fecal or a rectal ozone first. You can see in the left. Then we go ahead and do the fecal transplant. You can see that slurry. And then I'm going to show you what we do after. And I think a lot of people miss this step, but we actually rock the dog. We pick him up and rock him. Poor Oliver. Not a fan, but we want to distribute that fecal matter into the colon and into the intestines as best we can. Now you need probably two technicians. Oliver weighs about 60 pounds, but you just gently rock them and they're going to rock them back and forth. This is a step that a lot of people forget to do, and it's really important to do that. After you roll the patient, you're going to send them home with their MBRT capsules. You're going to make sure that they have the appropriate diet and supplements to go home. And then you monitor the post-transplant. We're going to do some follow-up testing as well. Oops, let's go move on. Okay, look at this. We retested Oliver several months later, and this is so impactful. These are the before results, these are the after results. We did two microbiome testings on Oliver. And if you see the first one, he had an elevated cell count. It's down to normal now after the fecal transplant and also the capsules and some of the supplements. His bacterial score and fungal score have changed pretty dramatically. Those have become almost normal. His richness is normal. 6.6, it came up from 5.4 to 6.6. His evenness score, which is great, is now even. His gut is much more stable. And then the fermenters, which is also huge, right? That's that burping stuff that you saw in that video. It's back down. So he's really done pretty well. And if you look below, the B12 has gone to normal on the testing and the folate has gone to normal. And I also do believe his vitamin D went to normal, which is huge. It's great. We really were successful with Oliver. I was so excited. I've been treating this dog for literally 7 years. So what's the mechanism of action? There's Oliver again eating rabbit poop. The mechanism of action is you want to use donor stool, like I mentioned, that has a diverse microbial community. Um, it will actually restore the balance in the recipient and its gut microbiome. And it's very beneficial for treating the dysbiosis, chronic diarrhea, irritable bowel disease, intestinal illness, just like in Oliver's case, or overgrowth of a fungus that shouldn't be there. I use it also in cancer patients. It really works nicely to help their immune system. So what's the future? Well, it's growing. I mean, more and more people are finding out about it. We're doing webinars and educating. I'm speaking at veterinary schools. I just wrote a textbook. Dr. Romans just wrote a textbook on microbiome. That should be due out as well. I'm very proud of that. It's been a long, hard project. I will hold it up. It'll be available soon. Um, the potential for broader use in treating immune and metabolic diseases. I mean, that's huge. We don't want to use too many drugs that we don't have to. And the case studies, I urge people to keep case studies, document. We're going to have a platform soon where we can actually start posting these. I do run an integrative veterinary group on WhatsApp. If anybody's interested, just email me. I can add you to it. It's a group of veterinarians around the world that chat with each other. Every day we have something. It's mostly around microbiome, ozone therapy, and mistletoe therapy, but it's a great resource for us to talk and to share cases so that we have an understanding of this. So we have positive outcomes in our patients, and we show a significant improvement in gut health. And in conclusion, it's a match made in heaven, right? A match made in gut heaven, I guess, if you will. The microbiome plays a major role in health. It's, again, 70 to 80% of our immune system. It will help with intestinal maturation. It'll help with pathogen growth. It'll inhibit that. Digestion of food, which is huge. Whenever we don't digest, we don't feel good. Our mood changes, hence gut-brain axis again. It regulates our hormones. It excretes toxins, and it helps with neuronal development. It helps the production of vitamins and other healing compounds, and it helps with immunoglobulins. It'll actually train the immune system to modulate, and it protects the mucosal barrier so we don't have a leaky gut. And it actually helps with synthesis of neurotransmitters. So it's a win-win. It's an easy win too. So what have we learned? A microbiome test for your patient can be really beneficial. I mean, I'm super excited about these tests because it really has helped me. It's been a game changer for me to understand what's going on instead of just taking something off my shelf and throwing it at them. I have backup now. I can say, yes, this is exactly what it is. It can actually identify bacteria, parasites, mold, yeast, and fungus. It gives you customized treatment plans. It can improve your quality of life in your patients. Why wouldn't you want to do that? It actually prevents secondary infections. If you look at that test, you can actually see other bacteria on there that might be creeping up, so you can catch it ahead of time. It's a great way to monitor long-term care, and it gives a peace of mind to the owners, and you have happy patients. So overall, a microbiome test for your patient can be a very valuable tool. in managing anything, GI issues, and you lead to a happier, healthier furry, for your furry friend. So you're a hero, right? Who doesn't want to be a vet hero? We all want to be heroes for our patients. This is the book that's coming out. I'm really excited about it. I have a protocol guide that tells, it gives protocol in detail of all the ozone therapy applications and ozonated glycerin now. It's a 60-page guide. We have a shampoo coming out, which is wonderful. VDI will also be coming out with that shampoo, an ozone foaming shampoo. So I'm super excited that the ozone world is expanding, and it should be in every practice a standard of care. I can't say enough good about it. And the microbiome as well, just super, super exciting to see how much success we're getting with these capsules and joining the symbiotic relationship together of ozone and microbiome. So that's it. I hope I've kept everybody amused. If anybody has any questions, I'm pretty focused on the ozone and microbiome. I'll be happy to answer anything that anybody has. Do you have any questions?
Well, Dr. Jyl, this is quite exciting, and thank you very much for sharing all this. We do have some questions here. So I'll go ahead and bring them up, and you can discuss it, okay?
Sure.
How is ozone and transplant affected by long-term use of steroids? Do they need to be stopped as well as other pharmaceuticals? So I mean, basically, if you've got a patient on steroids or on other pharmaceuticals, this is going to be something that's going to, inhibit the use of it. Do you have to stop it? What do you need to do?
Well, going way back to the beginning of the slide presentation, everybody's an individual. So, and that's it's our responsibility to treat our patients as individuals. Gone are the days where we do these giant vaccine clinics and they just roll through. I think it's important to look at the individual. It's always my goal to slow the steroids up. We know what steroids do. Yes, there's a place for them in medicine, but I think decreasing them, monitoring them, repeating these microbiome tests can be very helpful, monitoring their liver values, and with hopes of gradually moving them off. You never want to pull somebody off of a steroid, of course, but I think also making dietary changes, that's huge, by the way, the diet. I think you could probably decrease that dosing, and I've seen it happen over and over again. A lot of these dogs are getting thrown on Apoquil or steroids, and it's unnecessary. We could treat with ozone, we could treat with microbiome capsules and supplementation. Vitamin D testing is huge in these animals. A lot of people miss that portion of it. I had no idea Oliver was deficient in B12, none whatsoever. Of course, he wasn't digesting his food properly. So it's important to find these things out and find the things that work so that you don't have to use these hardcore drugs. None of these things are hardcore drugs. This is all pretty natural medicine when you look at it, despite the fact that I used antibiotics, but I used them judiciously and I used them appropriately for what I needed them for. And then afterwards, the dog got another fecal transplant to take care of the biofilm that may have been created by those antibiotics.
You find that you have to do the transplants more than once, or is most of the time is it pretty successful just doing it once?
Again, depends on the animal, but I find that it's good to do them a couple times. That's been my experience. If you can do them more than once, twice, depending on the animal, it seems like in Oliver's case, we did it twice. Even the owner was so excited about what happened, she asked for it again. And that's usually what happens is, can we get it? Can we do another one of these? They're so excited about seeing the success of it. It's really not that expensive either. I mean, this lady has spent thousands of dollars on this dog, as you can see by all the testing. And we did something so simple. I didn't know about that 7 years ago. I mean, I was doing ozone, but I didn't know about some of these things that could actually create change. I didn't know about your test, right?
Yeah. So, in terms of antibiotic use, now, how long have you been using ozone? You've been using ozone, I think, since what, 2015? Is that correct?
Yeah, about then,
Yeah.
quite a long time, but I wasn't always really as passionate about it. It took a long time because don't forget when I started, there was no protocol guides. There was one textbook out that was mostly research. And when I started, there was really nothing. Like it was a bumpy road. I started with longevity, and longevity used to say, "Oh, call Dr. Jyl." I'm like, I don't know what I'm doing. I
Well,
had no idea.
you are a trailblazer. I remember when we had the NT Pro B and P test. That's how we met, remember?
Yes.
Yes, and you started using that, and then we came out with vitamin D, I mean, you were on what, Fox News or Fox shows and
Yep,
CBS and
yep.
all different things pumping vitamin D testing too. I
Yeah,
remember that.
yeah, vitamin D. I love it. I can't say
You're
enough
a
good about it.
trailblazer. I love that about you. Yeah. So the thing about, are you finding though that with using the ozone, that are you using less antibiotics now than you would, let's say, in the past? I mean, like antibiotic responsive diarrhea or not responsive, as the case may be. I mean, you'd only know that if you're using antibiotics. Now, if you're not using antibiotics, then are you then seeing a reduction in the use of ozone in that case?
It's amazing. People walk into my pharmacy now, and I have a whole room that's a pharmacy, and the entire pharmacy, with the exception of two shelves, are Western drugs now. I think if I grab a bottle of Flagyl off the shelf maybe twice a year now, that's saying something. I don't use it. I just don't.
Mm.
There's no reason to be using it if something else works. I will use it if something, for example, comes in as a culture, but Randy, I'm not even using culture and sensitivities at Antec anymore. I'm sending my urine samples to you. It's killing me because I have to wait 2 weeks, but I'll tell you what, it's a game changer. I was treating a dog with this urinary tract infection, chronic. Nobody could figure out what was wrong with it. And I was like, let's just send in a urine test just as on a whim. And it came back as mold. And you know what I
Yeah,
did? I
well,
did,
it's amazing. I know.
it's insane. I know. And I
But
did
what about that
ozonate.
case that we had with also, I think, remember we had that one that came out with mycoplasma? We had that mycoplasma case,
Yeah.
and we've had all sorts of weird things showing up
Yes, we
you
have. And
otherwise wouldn't see.
yeah, this dog with the mold, I did ozonated glycerin in its bladder. And in fact, I just checked another dog today. It's like it's almost gone. It's insanity, the power of ozone and these tests. I really like this test for the urine. I will say that, and the skin. I've had some really cool cases with skin. I think that one case that I talked to you about with the dog that had the mold in its toe, and the other vet wanted to amputate. The dog was on 11 kinds of antibiotics over 11 months. And
Yeah.
they did cultures, believe it or not, and it wasn't working. And we did ozone and we limb bagged, and the lady was ecstatic. And I would have never known that had I not done that test. I would have never known what it was. And they came to me for a second opinion because I literally have it in the notes. Recommend amputation on a 3-year-old dog. It's insanity
Mm.
because they couldn't get the infection down.
Here's a question that popped up. Will just one ozone rectal insufflation get rid of the gut biofilm, or should you do several a few days apart prior to transplant?
You can, it depends on the case. So in my cancer patients, a lot of times I'll do, 4 or 5 days in a row and then take a few days off. But it's not wrong to do that. It depends again on the case. How bad is the biofilm? It's never going to hurt. You just want to go low and slow, is what I tell people. If you have a very sick animal, you don't want to have what's called a Herkimer reaction, where you're putting so much ozone in, you're killing off so much bacteria at the time, you can
Mm.
create an anaphylaxis essentially. So start slow and low. Instead of doing 40 or 50 gamma, go with 15 gamma. It's not going to hurt anything. If anything, it'll start getting things going. But you certainly can do, I have some people they can't afford a fecal transplant right away. So they do rectal ozone and they do the capsules, and then they'll come in for the transplant. And that's not wrong either.
I see. Now, do you ever just do rectal ozone only and no transplant at all, no capsules?
I do sometimes. It depends on the
Under
case
what
again.
situations would you just do rectal ozone?
If I have an animal that comes in that looks a little punky and they're not feeling well, or if somebody declines, I had a dog today that I was just dying to do a transplant on, and they declined the transplant. They declined the ozone, but they took the capsules. That's
Okay,
what's so interesting. I mean, everybody, like I said, everybody's a little different, so it just varies on what people want too. You have to look at their pocketbook, you have to look at their, how often can they get in to see you to do rectal ozone.
right,
If they can come in every day, great. If it's a cancer patient, hands down, I want them in there 4 or 5 days a week.
right, right. Well, Dr. Jyl, thank you